Yeah. Yeah. Abhedya, you can unmute. Abhedya, you can unmute. Yeah. Are you
Hello, sir.
ready?
During role play, how may I address you?
Are
Yes,
you
sir.
ready? Yeah.
Yes, sir.
Yeah.
Sir, during role play,
You can call me Abraham Lincoln.
okay, sir.
Yes.
Good afternoon.
Good afternoon, nurse.
My name is Abhedya. I'm your attending nurse today. Abraham, you seems to be very depressed today. So, could you please tell me what is the reason behind it?
Yeah, nurse. I'm not very comfortable. I'm not very happy. Why should I tell you all these things? What is the use? Tell me. There is any use, I'll tell you. I know that I'm going to die and I don't want to share anything. These are all personal feelings. It's okay.
I can understand your situation, but for your better treatment, for your better future, I have to list down that feelings and all. So, it's for our documentation purpose. So, for my better understanding, could you please tell me what is bothering you or what kind of fear are you feeling about your condition?
Yeah, I'm not very comfortable. I'm afraid of my situation. You know, I have this end stage renal disease and I don't know how long I will last. And my health is steadily deteriorating. I feel lonely. I feel depressed. I feel neglected and, alone. I don't know what I'm going to do now with this condition.
I can acknowledge your condition, considering your loneliness and all the facts are you suffering from. There is a one better treatment option you don't have to worry about. If you follow all these treatment options and all, you will feel better. Uh, there is one treatment option known as dialysis. In dialysis, we will take patient's blood and put it into dialyzer machine, and this machine will purify your blood and insert back into your body, and we have to start this dialysis as early as possible. So are you getting my point?
Yeah, of course, nurse. And I hate dialysis and I feel that a donor will never be found in time.
So don't worry about it. We will definitely find one donor, but until and unless we have to be start dialysis treatment. If you don't start the dialysis treatment on time, you would suffer more. So are you getting?
Yeah, of course, nurse. I accept, but I demand to be nominated as not for resuscitation if I have a cardiac arrest. Hello?
Okay, Mr. Abraham.
Yeah.
Okay, Mr. Abraham. So you want to not for resuscitation.
Yes,
So
nurse.
before that, you have to consult with our consultant, and he will support your decision, and he will put you on a list of not resuscitation patient. But before that, you have to write a request form to him,
Okay.
and if you write the request form, it's not means it is necessary. It is our hospital policy. We respect that, but writing with you have to write respect form request form, and your family members are also present at the time it's necessary.
Okay.
So according to these conditions, according following these guidelines, according to our guidelines, you have to write a request form along, and your relatives must be present.
Okay.
That's it.
Okay, nurse, but I am not very much comfortable. I am not very much comfortable. Please, I don't know. I am not interested to see a counselor.
Oh, I can acknowledge your feelings, but you have to visit your consultant, our consultant. He will definitely provide you a right path. He will definitely guide you according to your situation. And you are listed for the transplant, renal transplant. And as soon as early as possible, we will find one new donor for you, and we will plan for transplant also. So don't worry about it.
Okay.
We have a really nice platform for renal transplant donors. We will definitely find one donor for you.
Okay, nurse, definitely. That's really very fine. But yeah, I don't know how to get on well with this one. And I want to tell you one thing. I want to be able to die with a dignity with my family present.
Okay, I can understand your feeling. You want to die with dignity.
Yes, of
Yes,
course.
but I already told you you have to consult with our consultant and complete the all formalities that are needed according to our policy. If you complete all the formalities, and they will definitely. I'm not the authorized person to tell you or suggest you according these guidelines. Before that, you will convey your information to consultant.
Yeah,
So are you with me so far?
thank you very much. Nurse, I understand. I agree with you. Okay, fine, no problem. Thank you very much for your suggestions.
Thank you for cooperating with us. If you do you have any other concerns?
No, nurse, that's very clear now.
We are here to help you. Don't hesitate to contact us. Just ring the buzzer if you have any hesitations or any doubts.
Yeah, sure, nurse. Thank you once again.
Thank you.
Okay. Yeah, right. Yes. Now, let us see your points. First thing is, yeah, you have to improve a little bit of fluency because you are getting stuck here and there in between. So, improve your fluency. Fluency means what? Not getting too many cuts in between, too many breaks in between, too many pauses in between. The flow of speech, one word after another word, one word. It may be fast, it may be slow. That doesn't matter. Your speed is not the problem. Your fluency is the problem. Fluency means continuity of speaking without pausing every now and then. That is called fluency. So, how will you enhance your fluency? By making practice to your tongue. Give it a practice of speaking English. Okay. Once you give practice, now automatically your tongue will get used to it and turn according to its. Fine. Next one, second one is accuracy. There are some mistakes here and there. There are some repetitions also. So there are number of sentences which are put in the group. Yeah, can you hear now? Sorry. Yeah, there are number of
Yes,
sentences
sir.
given. There are number of sentences given in the group. Yeah, your fluency you have to improve, and a little bit of accuracy you have to focus. Learn the sentences which are given in the group. Number of sentences, number of people are typing and putting. See, try to use those sentences. Check if they are correct or not. And if you have any doubt, you can send me, and I will correct and I'll give you. Right. The next one is you have to use these styles on a daily basis. When you do that regularly, When you do that regularly, then it will be easy for you to practice these sentences and implement those sentences in the real speech. Automatically they should come without any hesitation, without any thinking. They should come word. So you have to start thinking in English and speaking in English. So without actually thinking, you have to able to speak on the spot. Words should come. So that comes only by practice. It's not so easy. It comes only by practice. It comes only by practice. Then, uh, so next one is, when you see the patient is reluctant, you have to be little careful. She's not interested, he's not interested, or whatever it is. He says, no, I don't want, like, angry with you, angry patient, reluctant patient, okay, adamant patient, arrogant patient, different types of patients who don't want to listen to you. They just want arrogant, he'll just blindly go ahead. Okay. So according to him, you have to be little cool and passive. Of course, you have every right. Okay. But the thing is, you are upset, you are worried. I totally understand. You are in a difficult situation and you feel depressed and worried. I totally agree with you. But we cannot ignore that one, right? We have to see the positive side of the world. So if you cooperate with us, maybe, okay, we can try some options, and maybe there's a possibility for you to live longer, because you want to spend life more. Okay, if you recover well and if you can manage your condition, okay, and come out of this situation, then definitely you can lead your life normally. But the thing is, at least you are living. If you are suffering, but still you are living. That So minimizing your suffering would be there possibility. Then afterwards, we can try. If we cooperate, if you don't cooperate, we cannot do anything, and the conditions may deteriorate, or the conditions may worsen. Okay, and the trouble may be even more than what is you are experiencing now. So it may be beyond expectation, and at a stage we or anybody else uh, cannot be in a condition to support you or help you. Okay, so because it goes out of the hands, then it will be a tough job. So better understand what we are trying to tell you, and try to implement, try to cooperate with us, so that we can implement the best possible practices for you. Okay, so for example, 3 weeks dialysis, you have to take it. That's okay. And kidney transplant, okay, maybe donor will be available or not available. There is a 50-50 chance, but still we can hope for the best, right? So be positive. Okay, optimism is not an ordinary thing. If you are optimistic, then your body will support you, your body will cooperate you with that hope. No, something is, if you are depressed, your body will not be ready to um, support you for treatment and okay, improvement. So your body also should cooperate, and when your mind is not ready, then automatically everything will be difficult. So these are some sentences which you can say. Yeah, you want that okay, decision not to be resuscitated. Okay, not for resuscitation. Yeah, of course, you have the
Sir,
right.
for reluctant patients, which are the beneficial means, which are important sentence to be used in conversation?
Yeah, so we are there for you. We are going to support you. You are our fundamental priority. You lack interest, but the thing is, if it is your life, okay, it's your life. Deep in your heart, you want to be positive. You want to come out of this situation. Okay, you are desperate, but you have to use some positive, motivating sentences there. Positive, motivating sentence.
Motivation.
He's reluctant doesn't mean that he's not interested. He's reluctant because he feels that nothing is going to work out. Okay, so you have to make him feel optimistic. Okay, you can say like this. Of course, now we did not get any donor for kidney transplantation, but there's a chance. It's not ruled out. It's not that we are not going to get. There are 50-50 chances. Okay, so we are trying our level best. Once it is done, then automatically, right? So this is the way how you can. bring him back to the mainstream. That's it. Okay. So fine. So now next, Mustaba.